All right, joining us now to talk about the rise in COVID cases in China and what Americans could expect, Dr. Anthony Harris, a preventive medicine physician at Elkhart General Hospital. Dr. Harris, thank you so much for joining us. Should Americans be concerned seeing and hearing about the spike in cases in China?
Well, thank you, Nicole, for having me on. And yes, we should be concerned because we know that numbers will go up from where they were just weeks ago. We've already seen it happen in New York. Obviously, Philadelphia, numbers have gone up. And we know these numbers are doubling, so increasing in some cases dramatically. And along with that, hospitalizations have although they've been plateaued for a while, they're starting to creep up as well. And we need to be concerned.
So as a physician, you mentioned that this mask mandate being reinstated in Philadelphia. Are you surprised by this? Do you expect more cities to reinstate some of those COVID restrictions?
I absolutely do, right? Because we know masking can protect those, not just those who are vulnerable, but those who will, get COVID-19 and unfortunately get long-term effects from COVID-19. Look, there's data now to show that COVID-19 can increase your risk of having type 1 diabetes, right? That's pretty serious. And this latest data is going to be something that I think we should pay attention to, as well as institute protections continually for the population.
All right, so this in Philly, this mask mandate being reinstated, but, is the up and down of cases, is that the new normal that we just have to get used to?
Yes, in a way, for the next 3 years at least, right? We said that COVID is going to be around in the healthcare community and experts with epidemiologists for 5 years, right? And so we're obviously over 2 years into that. But again, we're learning more and more about not the risk of death from COVID, but the risk of poor outcomes or permanent effects potentially, and long COVID, and like I mentioned, risk of type 1 diabetes with no other risk factors being amongst them. And it's a perfect storm. Our waning immunity from the peak of January 15th is hitting right about now in terms of people losing that immunity. And we have now the lag between what we see in the UK starting to happen here, which is usually a 6 to 8 week. And this is the time we predicted numbers would go up.
Well, speaking of this is the time, here it is spring, people trying to get outside. We do it here in Chicago, when the weather cooperates with us. But, summer's approaching. People obviously want to get outside, enjoy some time just being out and about in the world again. What are you telling your patients in regard to COVID safety?
Sure. As a Chicago native, I agree with you. It's time to get out and about, right? Enjoy the weather, but be cautious, right? And so what I'm telling my patients that are vulnerable, that have pre-existing conditions, I say, look at the numbers. Diabetic individuals in the U.S. make up over 40% of the deaths from COVID-19. So there are still real risks. What no one is talking about is our case fatality rate, which is 10 times higher almost than what the case fatality rate in the UK is. It's higher than Germany by almost 8 times. And so there's still a significant loss of life that's happening on a daily basis. And we need to protect those individuals. We need to protect ourselves, and masking is one way we can do it.
All right, Dr. Anthony Harris, thank you so much for joining us. We appreciate it.
Thank you, Nicole.
Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.